63-year-old male here for pain and swelling over the lateral ankle for about 4 or 5 days. No injury. He does have a history of gout. X-ray didn't really show a whole lot other than soft tissue swelling. So I'm going to go ahead and just do an ultrasound today of the lateral ankle. Here we're going to do a focused anatomy tutorial of the internal lateral compartments of the leg. You can appreciate the tibialis anterior, extensor digitorum longus muscle, and extensor hallucis longus muscle, as well as the peroneus tertius muscle, as well as the peroneus longus and brevis muscle and tendons, which you can appreciate here. Now we're making the peroneal sheath translucent. You can appreciate the peroneal tendons. And now we're making the peroneal tendons translucent. And you can appreciate what I believe to be a Gouty Tophus within the peroneal sheath. A little bit difficult to discern as it kind of blends in with the sheath itself. And here we're making the tophus a bit darker so you can visualize it a bit better. Here you can see the talus on the left, the fibula on the right. You can see this linear fibular structure spanning the gap between those two structures, consistent with the ATFL. Now we're going to look at the peroneal tendons in short axis, and this is where much of his pain is. You can appreciate this very irregular tophus within the peroneal sheath. Also, I believe there's some tenosynovitis around it as well. And it's really hard to make out the margins of the peroneal tendons as there's so much tenosynovitis and tophi and probably some calcification of those tophi as well within this peroneal sheath. But this is where he was tender. His ankle was swollen laterally, and this is all consistent with a tophaceous gout attack. Here you can see the peroneal tubercle separating the peroneus longus and brevis tendons, with the peroneus longus to the right and the brevis to the left. Here we're going a little bit further distally. Peroneus longus tendon is going plantar to attach all the way on the plantar medial aspect of the foot. Here we're more proximal now down the distal leg, and we can see the peroneus longus and brevis tendons. Here we're back distally. We can see that there appears to be a concavity in the fibula, perhaps from erosion from this tophus. But I did not see this on x-ray, so this may be an overread on my end, or perhaps a subtle finding on ultrasound. Now we're going to look at the peroneal tendons in a long axis view. A little bit difficult to discern the two tendons, but I believe you can see some layering of the tendons here, with the brevis closer to the fibula shaft and the longus on top of that. You can appreciate the tophus both on top and kind of within the tendons itself, it seems. And there may be more of a calcific tophus more proximally, which you can appreciate here. Here's another view of this tophus, which again, I believe he has multiple tophi, but this is, I think, the main one giving him symptoms.